Good afternoon. I'm Imran Umar. I work for the EU Guidelines Office and I'm based within the University of Aberdeen. Nocturia is defined by the International Continence Society as the complaint that the individual has to wake up at night one or more times for voiding. Nocturnal incontinence occur after the age of 3 to 5. We systematically reviewed the available evidence of comparing the benefit and harms of different treatment options for patients with nocturia or nocturnal incontinence. In this systematic review, we only included women. Literature search was performed by using Embase, Medline, and Cochrane library. We followed the PRISMA guidance, and we also followed the Cochrane handbook in our methodology. The protocol was registered at Prospero. We adopted the grade approach in order to assess the certainty, also known as quality of evidence. Now, as you can see that the flow of literature is graphically illustrated in this PRISMA flow diagram. We identified 3,573 citations. After deduplication, we had 3,475 abstracts for full text for abstract screening. After abstract screening, we had 195 articles for full text screening. And finally, we identified 11 relevant studies. Out of those 11 relevant studies, 10 were randomized controlled trial, and there was one non-randomized comparative study. On the left-hand side, the risk of bias assessment of the 10 randomized controlled trial is graphically illustrated. Red indicate high risk of bias, yellow indicate unclear risk of bias, and green indicate low risk of bias. As you can see that a number of studies were judged to be either high or unclear risk of bias for several domains. And this has some implication when we were doing the quality or certainty of evidence. We identified 3 RCTs that compared desmopressin with placebo. All these 3 RCTs, they used different dosages of drugs. Moreover, one trial used 4 different dosages. As you can see in this forest plot that the result indicate that there was fewer episode of nocturia in patients receiving desmopressin. This is strongly illustrated by one study which has the highest sample size. As you can see, that is clearly indicated that, the episode of nocturia in women receiving desmopressin was lower. We identified one RCT that compared oxybutynin with placebo, and again, you can see the similar trend that there were fewer episodes of nocturia in patients receiving oxybutynin. We did not identify any study recruiting women with nocturnal incontinence, and majority of the outcomes were either rated as low or very low when we adopted grade. This was mainly due to methodological flaws in the studies. In conclusion, there is some evidence that desmopressin and antimuscarinic are effective treatment options for nocturia in women. There is very limited evidence for other treatment options. We did not find any study recruiting women with nocturnal incontinence. Thank you for listening, and I'll be happy to take any question you may have.
Thank you for your work. May I ask you first, because there's roughly 100 RCTs in antimuscarinics, they probably typically have 80% women, and they quite often measure nocturia, however, not using frequency volume chart. So is it because they also have men, you didn't exclude them, or why don't you have those studies included?
Yeah, our inclusion criteria were very strict. I mean, we only included women with nocturia. So suppose if there was a study which included both men and women, we tried to get hold of those studies, and we tried to get individual patient data, but because we had very short timeline, so we were unable to get hold of the data. So we might later on do individual patient data analysis. That's one of the possibility. The other thing which I want to mention is that we were also excluding women who had a combined or overactive bladder, because again, we had very strict inclusion criteria. So that could be like a future project in which we can do individual patient data analysis, and we might be able to strongly answer the question.
And what about why didn't you pull the estimate? Why didn't you meta-analyze?
Yeah, in fact, as you can see, there are different dosages of drug, and we did meta-analyze to see how it looks like, and it was strongly favoring the drug as we meta-analyzed. But we thought, because like all these trials, they were using different dosages of drug, so we decided not to pool them because of the heterogeneity.
Other questions, comments? Thank you very much.
Thank you.